I thought it would be helpful to go through the most common reasons why I refer patients to see someone like you. And I want to tell you that in my experience, when I tell a patient that they should see a pediatric neurosurgeon, they look panicked. They're scared. I think a lot of them assume that they're going to need brain surgery. Is that true? Can you reassure people when they come to see you, how often is it that you end up needing to operate?
Well, yeah, I mean, overall, it's actually much less common that any given person who gets referred to me needs surgery. Far more common, it's something that is, kind of unclear or maybe should be followed or investigated a little bit more, but the vast majority of cases don't need surgery. And if they do need surgery, again, the vast majority of the time, it's very important, but also can really save someone's life or make their quality of life much better. We don't offer surgery unless the risks are outweighed by the benefits. We wouldn't be doing it if it wasn't safe. And so my job is to reassure anyone in that moment that, yes, you might need brain surgery, but it's very safe. We have a lot of experience, we know what we're doing, and we will help guide you through the entire process. But to answer your question, vast majority of patients who are referred to a neurosurgeon don't actually need surgery.
Thank you so much. So, a very common reason why parents are concerned is a young child will fall and hit their heads. And there's a lot of confusion out there when to be alarmed about head trauma. Can you explain what are concerning signs and what are some reassuring signs?
Yeah, absolutely. First of all, it's extremely common. I mean, it's every single day kids come into the ER having fallen somehow. Mom dropped baby while they were breastfeeding. She fell asleep because it's 4 in the morning, or the kid running around like a maniac and trips and falls and hits their head, or any number of situations. Extremely, extremely common, and the vast majority of the time it's totally fine, and it does not impact the child in the long term. But it all depends on the age of the kid, the mechanism of injury, and what they look like immediately following and then thereafter. If it's a really tiny baby, yet less than 3 months, it's always good to bring him to the emergency room no matter what. But in general, reassuring things. There's no loss of consciousness. If there is a loss of consciousness, it's less than 5 seconds. If they've returned to their baseline behaviorally, it's very reassuring. If there's no other problems like seizures or persistent weakness or sleepiness or they're just inconsolable or persistent vomiting, those are things that are more worrisome or suggest that we should definitely get some imaging. If the baby or the child hits their head, bounces right back, is running around, eating, drinking, peeing, pooping, has no other issues, chances are they're completely fine and we'll just send them home. And so it's kind of a different kind of algorithmic pathway, and there's little branch points that depend on, if it's a higher impact trauma, let's say you're in an actual car accident and someone in the car gets ejected from the vehicle or there's an airbag that goes off, that suggests that we really need to take a closer look at things. If it's a fall from a 2-story window as opposed to from mom's lap, that changes what we're going to do. Probably err on the side of imaging. If it's just a small fall from standing or down a step or two, and the kid looks totally fine, there's no obvious abnormalities on the scalp or skull, then it's probably just a close observation thing for a few hours and send the patient home.
Okay, so essentially what you're saying is as long as after the fall they don't lose consciousness, they maybe cry right away, but then they quickly return back to acting like they normally act. They're eating, they're playing, they're behaving as per usual. They don't need to see a neurosurgeon.
Correct. And frankly, the vast majority of these patients don't see a neurosurgeon. They come into the ER takes a look, they do all this stuff. We get called if, there's some imaging finding that's concerning, like a fracture of the skull, or there's a tiny bit of blood in the head. Now, even if they find those things, the vast majority of those kids do totally fine and don't need anything from me. A non-displaced skull fracture will heal. You don't need to treat the baby any differently. You don't need to wrap them in bubble wrap. You don't need to do any kind of close follow-ups. Their skulls just are incredible. They heal very fast. You don't need to do anything. Blood inside the head. Anybody who falls and hits their head will probably have some tiny bit of blood that just kind of, it's like anywhere else in your body, and it just goes away. It'll just be reabsorbed with time. So same thing with babies and kids. We might get an image that shows a tiny little speck or two of blood, or even a little bit more on the scan, but the vast majority of those, we just get another image, make sure it's stable, and then that's it.
Wonderful. And okay, can you set the record straight? After there's an injury, after a kid hits their head, do you recommend parents waking them up throughout the night just to make sure that they're okay?
So I would just say that in general, probably not. It depends on the timing of the injury because, of course, it can be kind of tough. You know, if you're at home after and your child has hit their head, but the kid is completely back to normal baseline, eating and drinking, peeing and pooping, behaving, interacting like they normally do, and you don't sense any differences, then no, I don't think you need to do that at all. It doesn't really benefit anyone, and only interrupts both parties' sleep.
I've gotten many pages in the middle of the night where parents will be frustrated because they will have awakened their kids in the middle of the night after a fall, and they're confused what to look for because kids are going to be groggy at 2 a.m. when you wake them up,
Right.
and they're not sure if they did the right thing. Should they have allowed them to sleep? So it's nice to hear from you that
Yeah.
essentially, if they're acting normal before going to sleep, you don't have to wake them.
Correct.
Okay. Now, what about a big goose egg on the front of the head? That question comes up a lot where parents are nervous because a child will fall and maybe it wasn't that bad of an injury at first, or it didn't seem to be that bad of an injury, but they'll get a really swollen goose egg. When should parents be concerned, and is that a concerning sign to you?
You know, in general, just like when you hit anything else or there's a trauma anywhere else, you'll have a hematoma and maybe a bruise. A hematoma just means a small little collection of blood under the surface of something. And when it happens on the scalp, that's when you see a goose egg. You know, if the injury, and usually it's a delayed fashion because the kid will bump their head and then that will start to swell over the next couple hours. If it starts to become very large or increasing in size at a pretty rapid rate over only a course of a few hours, or it becomes very tense and very painful, I would definitely seek medical attention. If it's kind of just stable in size and it's not bothering the kid and there's no really obvious underlying fractures or extreme pain, then it's probably just going to go away and keep an eye on it. And if after a couple days it doesn't go away or it gets bigger, yeah, then you can seek, the pediatrician or the emergency room's help. And again, in the majority of cases, just a little bit of blood. The blood starts to break down. There's some swelling, some fluid gets into that area, so it bulks up, and then the body kind of dissipates.
So, what I'm hearing from you, it seems like so much boils down to how a child is acting. If they have a big
Yeah.
hematoma or bruise in the front of the head and they're acting and playing normally, that's okay to observe. But if they're acting like they're uncomfortable in pain, they should seek medical attention.
Yes, and that's how, frankly, in general in neurosurgery, everything is important, but the most important thing is how the patient is doing, because we can see a lot of things on images. It doesn't mean that we act on images. We act on the patient and how the exam is, because they tell us what their brain is doing. And seeing that a child is eating and drinking, they're laughing, they're playing their video games, they're interested in the same, they're not any different. That's far more important for our assessment than whatever we see on an image. Very rarely will there be a discordance to the point where we still need to do something. You know, that happens, but in the vast majority of the time, it's all about how the patient is doing, and especially in kids who can't report that. Oh, I had this weird ache. They're not articulate. They don't have that capacity yet. It's just how they behave. You just have, them as the parent. You know what they're like, and when they're different, and just being able to kind of detect that is probably the most important thing.
And I'm just curious, are there any cautionary tales that you've experienced as a pediatric neurosurgeon? Like, for example, I worked on the burn clinic. I worked in the burn unit for a while. And after I saw a number of kids have burns from top ramen getting too hot and they would put it in their lap, and I saw so many burns on the inner thighs from top ramen. I have never bought my kids top ramen soup, and I probably never will because I remember that story. Has something similar happened to you where you've seen an event happen enough times where you envision yourself being cautious with your own kids?
That's a great question. No, I don't think so. I mean, life's crazy and kids are resilient. And you can't wrap them in bubble wrap. And in fact, it's so important to not wrap them in bubble wrap because they will fall, they will bump their head, they will do crazy stuff. And obviously, things like keeping small objects away so they don't inhale them, and pennies and button batteries and stuff like that. You can't prevent every single thing that's going to happen. I think you just drive yourself crazy trying to do that, and it's just counterproductive.
I love hearing you say that honestly, because coming from a pediatric neurosurgeon, you've seen the worst. You could sit here and say, oh, I don't want my kids to ride bikes or I'm not going to let them climb trees. But it's so refreshing that even you, who has seen the worst of it all, still agrees that we still should encourage them to play and be kids and be adventurous.
Yes, a 100%. The notion of anti-fragility, I don't know if you ever heard that term, but it very much applies. You know, the fact that not only are kids not fragile, but they're anti-fragile, meaning if they don't suffer the bumps and bruises and normal physical interactions of everyday life, they will become more impaired. And so you want them to be able to just be exposed to a healthy, active environment.
Dr.
Of
Bonda,
course,
I have to tell you, it's so refreshing to hear you say that because I find that a lot of doctors that work in the ICU or tend to see scarier medical situations, they tend to be more cautious because you can't help it, but you have those stories on the forefront of your mind. So that's so great, I think, that you still have that mindset.
yeah.
Because I agree with you 100%.
The couple of things that of course, I think you probably recommend too is always wearing a helmet during things like scootering or bicycling, etc. Or, I probably won't let my kid play tackle football if they even want to, because I'm not anything remotely resembling an athlete. But, that's a whole different story and a conversation. Of course, everyone has their own decision to make with that. But, those are just like general things. But as far as avoiding aspects of daily life,
Yeah,
seatbelt, helmets, that's it.
the big ticket items.
Big ticket items,
Yes.
exactly.
Well, thank you for that. That's really helpful.